The General Practice Improvement Leaders Programme is a 6-day course, and we offer that nationally up and down the country. It's a 6-day programme that offers you the opportunity to come and learn about the detail of the tools and the techniques and how to apply them in real time in your own practice. It also gives you the offer of understanding how to facilitate and present those skills when you go back to your own ranch as well, so that you can take a wider group of people with you on that journey of improvement. So why is it Farzana and I here today and not some of our other colleagues? Well, back in September, as part of the General Practice Improvement Leaders team, I was a facilitator. And as we were sharing our tools with the group of delegates, the very first cohort in Camden Lock, Farzana was a member of that cohort. And I could see the light bulbs that were going on for her, and the revelations coming out were just extraordinary.
I was really amazed that these skills that I learnt I could actually use in everyday practice. It wasn't just a course that I could shelve for the rest of my life. It was everyday skills that were really doable. So here's me, and these are two of my patients who have given consent. This gentleman here is 22 now, and I met him when he was only 10 years old, and that's his mum next to me. And he was born at 28 weeks. He was really premature, and he really is the reason I do what I do. You can imagine he still has some medical problems, having been born so early. And apart from being a GP, so I also have a federation role, and I've been able to use a lot of my learning from the course, not just in my practice, but in my federation role in the community as well. Newham is quite a deprived area, one of the poorest areas with a lot of health need. And the path that you just can't see on the left of the picture is referred to as Muggers Alley because it has such a high crime rate, and we have had the police stake out at the practice to see if they can get some criminals. Having said all that, it's a real joy and a privilege for me to work there. This is a picture of our builders just opposite the surgery, making new homes. Newham doesn't have very many homes, but we've got some flats up for rental, and the builders even given one of my receptionists the drill to hold there as a trophy. And we have a lot of our patients that live literally a walk away, and many of our housebound patients live a walk away. We had quite a sad case just last year when an elderly patient of ours passed away, but was found dead after 3 weeks by the police, and her trusty cat was found dead next to her. And it made me think, what are we doing for our vulnerable elderly? And I had wanted really, Sue, to think about putting a session in for visiting housebound patients, but where's the time? Where do I start? I just wasn't able to really get the headspace to think about it. Since I went on GPIL, I've managed to implement some systems, and it's been much easier to actually have a set system to visit those patients, and of course it's helping with the Avoiding Unplanned Admissions scheme that we're part of nationally. And it has actually reduced some time because we're finding that we're getting less calls for emergency visits. But I don't think I would have had the skills or the knowledge to implement that unless I'd been on the course. This is a photo of me and my second year medical students. That's Rebecca and that's Mark, and it's a joy to teach them. This is their first time in practice, and I consider quality improvement now a daily part of my life, so I love sharing it with them. And I am Newham GP Federation's Quality Improvement Champion. So for me, the time for change is now. I've been a GP for 15 years, and was quite frustrating to try and implement ideas and keep falling on my feet. I don't know if other people in the room have also felt that, but it's very frustrating and demoralizing. And just going on the course just gave me some of the tools that I needed just to make those small but really important changes that stick. And it's made me feel a lot more hopeful, really, and curious, really, to try more little changes in the practice, and I'm quite confident about the ones that we've implemented so far. think one of the things about the course wasn't, and many of us have been on many courses, wasn't just about the content of it, it was the way it was taught and the safety and the warmth I felt in it. And there were certain bits that really spoke out to me, and I wanted to make a small change, and that small change came from a little tool called the change model, and that really spoke to me. And it's made up of a number of elements, which I think Sue's going to show you, but two really stood out for me. One element of it was leadership by all, because it is very exhausting trying to do all the change and all the leadership yourself, and particularly being a single-handed principal. And I could really feel the weight on my shoulders, and I thought, this looks good. And the other one was really a shared purpose that I talked about before with Peter, my senior partner's legacy and my ethos. And the shared purpose, really, I could also relate to just life in general. So it made me think about when they're teenagers now, my two kids are 13 and 14, but my husband works in hospital, and I would always wonder why bedtimes were a battle. So I would be trying to put them to sleep at 9:30, and he would come in and start bouncing them around, and you can imagine that wasn't shared purpose. And if I had known this, we probably would have managed to save quite a few arguments and threats of separation on my part.
So a lot of the skills you can actually share in your wider life. As Farzana mentioned, this is the change model for health and social care, recently revised, made up of 8 components. And behind each of those jigsaw pieces, there's a set of tools and techniques that we explore during the General Practice Improvement Leaders course in a lot of detail, and we apply them with you to the projects that you bring when you're on that course. So the tools and techniques that you have actually experienced on the course, which ones did you choose to use, Farzana, and why?
The change model really, for me, is something that you can use in every aspect of your life, looking at shared purpose. And I've used it in a lot of my federation work as well, because sometimes you just feel stuck. In fact, I used it yesterday, and we weren't sure where exactly we were, and we were stuck. And I actually said, what is the shared purpose? And it's such a simple yet really powerful question, just to think about, where are we? What are we wanting to do to take stock? Process mapping is something I'd never heard of, and once I'd done the course, I thought, why have I never heard of this, or why didn't I hear about it earlier? It's been really useful in just looking through some of our systems and just being able to think about how and why they work or they don't work. Plan, do, study, act really spoke to me, Sue, because I'm very much a doer, and I tend to go in head first and feet first, and then wonder why my ideas don't stick. And measurement is just something I didn't really like, so I thought I ought to try and give it a bit of a go. The picture on the left is me and my reception manager, Shuzna, and we all have practice meetings, I'm sure, and just once in a while we have some practice team building meetings as well, which involves getting a takeaway at 1 o'clock and playing some board games, and we have a lot of fun, and it does actually really increase communication and increase energy levels. And I always find that afternoon surgery works really positively and enthusiastically. So this was one of our games, and if you can see on the left here, I'm trying my best to cover all the colours, but failing miserably, and I've sort of become unconscious after exhaustion. And I can't quite reach the green, despite the fact that I've tried. And that just reminded me of how, it's end of year, we're trying desperately to reach those QOF targets, but not quite managing. And it looks like my reception manager is hoping that divine inspiration will come to her. And on the right, we're just working together. We've got a lot more shared leadership, and she's actually supporting me, and we've got it all covered. Another tool, which I haven't put up here, the SDI. So I don't know about you, but I'm someone who likes to complain quite a lot, and when things don't go my way, I tend to blame others. And one of the nice things about the SDI, it made me think about how I behave in a situation like a conflict situation, what I can do about it. And that's really helped me work a lot more collaboratively with all my roles in the practice in the Federation.
The SDI stands for Strength Deployment Inventory, and it's an accredited tool that is used right across the country, from Sainsbury's, British Airways, the military, and it helps us to understand ourselves. But what it does that other tools don't do is helps us to understand what happens when we find ourselves in conflict. You know, when you're working in an environment and your buttons are being pressed and you're thinking, oh, I'm really not liking what's happening here, and it's giving you that sense of heightened self-awareness of why am I feeling like this, and it helps you to understand how to get back to being without that conflict so that you can be the most productive person that you can be. Because once we're in conflict, we lose an element of our productivity and our effectiveness. The process mapping is a tool that Farzana's referenced, and basically it's a really simple tool. It's a powerful tool though. If you get the right people in the room to have that opportunity to understand about the issue that you're looking at, you've got all those multiple perspectives being shared at the same time.
In our practice, we were finding that quite often the clinicians were being bothered when they were with the patient with a message, well, probably a very important message. We wondered if that could be done better. And really, Sue, had I not used the process mapping, I assumed that by changing the message-taking system to receptionist messaging via the computer system would be better and more effective, and there would be less interruptions. But of course, I'm only one part of the jigsaw, I'm only one part of the model. So once we did this exercise, it became really apparent that actually there was a lot more to what the receptionists were doing, and it really filled the blind spots for me. And I think the benefits of this was that we understood each other's roles, we understood what we were doing well, we could actually colourfully visually see it, and we could understand what we weren't doing well. And the outcome was actually that we will continue verbal because the receptionist got a lot more added value, but we would use the computer message system for certain tasks. And so we got a better collaborative solution that has stuck, that we would never have done had I just thought, oh, let's stick it all over to the computer messaging system. And that could be why previous ideas just never really stuck. We never used these tools.
So Plan, Do, Study, Act is about testing change ideas on a smaller scale, agreeing what you want to test, doing the test, measuring the impact of it, analysing what has happened, looked at the evidence before you had the intervention and looking at the evidence afterwards, deciding, do you want to repeat this cycle, this Plan, Do, Study, Act again with a slight change based on your learning, or are you ready now to go for a wider implementation?
The first time Sue and the facilitators talked about Plan, Do, Study, Act, I thought to myself, I'm a busy GP, I haven't got time to do all this rubbish, I'm just going to carry on doing. And then actually I thought, well, I'll give it a go. And we used it for our repeat prescribing system, where we were getting a lot of patients who had collected their prescriptions, and I wanted the receptionist to then code that on the computer. And I was really nervous about asking them. I thought, oh God, it's going to be more work, and I'm going to get tomatoes hurled at me. But what was really interesting is when we spoke as a team, they readily wanted to do it, Sue. And what I didn't know is that actually they were spending a lot of time with patients coming back to collect prescriptions that had already been collected. So they said, oh yeah, that sounds like a fantastic idea. And we studied it, they did it, and that again is something that stuck. And that fear that I had about asking them to do yet more work changed into joy to see how much they wanted to do it. So, and I think the benefits of it really, so it didn't take that much time to implement. I thought, oh my God, who's going to do Plan, Do, Study, Act? But it was about an hour at a meeting. It really wasn't that long. And it saved time now, and it's safer for the patients because we were issuing prescriptions twice when we didn't need to.
Measurement was the one that Farzana very honestly shared with you wasn't going to be her easiest one to adopt. When we look at measurement on the course, we look at what to measure, why to measure. Do you have a metric that's related to a structure or a process?
I can now see why measurement is so important, because if you don't measure it, then you actually don't know where you are. And as I say it, I think, I don't know why I didn't like measurement, because actually, as GPs, we do audit on an annual basis for our appraisals. So it's really just an extension of that. But sometimes it's sort of the memories that I think GPs sometimes have with measurements, and sometimes we feel a bit judged on measurement, but this is very different. It's having the freedom to think about what you want to measure, and you know why, and you've got your goal of why, and that's much more empowering. And you can't really, as Sue said, it can't do any harm. You can't go wrong with it. You can only improve. And if it wasn't such a good idea, at least you'll know in the early stages of the PDSA and not waste all that time. So Sue, for me, I mean, quality improvement for me has been life-changing. One of the facilitators, again, Jo, she said to me, Farzana, you don't have to be a hero, you know, leadership can be done by all, and it almost allowed me to think about that. And I think sometimes we do as GPs really struggle on our own when we don't need to. It's made me feel much less isolated, and it's given me quite a lot of hope, and really it's made me go back to feeling young, even though maybe not looking young. But when I was 19, I sat at a medical school interview and they said, why do you want to be a doctor? And I said, I want to help people. I want to be able to give even the dying patients some hope. And this has brought it back.
We offer this course as part of the Time for Care programme, and we work with the LMC, we work with the CCGs, we work with federations, and to access the course is a simple online registration.